Welcome to the Truth About Utilization Management, what every nurse needs to know, presented by Healthcare Nurses Network and Nurses Link Up. Whether you're a longtime listener or just joining us, we're glad you're here. This podcast series explores Dr. Nicolas Abella's essential articles on utilization management, with hosts James Carter and Emily Ramirez translating insights into practical skills for nurses. If you're just tuning in, previous episodes laid the groundwork, defining utilization management, mastering documentation, and building collaboration. But today, in episode 6, we hit a topic that impacts every nurse: denial prevention. Insurance denials cost time, money, and can negatively affect patient care. Based on Dr. Abella's 6th article, How Nurses Can Prevent Denials, this episode dives into proactive strategies. It's not just about reacting to denials, it's about understanding their root causes, often linked to documentation and communication, and stopping them before they happen. Get ready for actionable insights. Here are your hosts, James Carter and Emily Ramirez.
Welcome back to the Healthcare Nurses Network podcast. We're here to make sure you have all the info and strategies you need to really shine in your nursing career. And, today we are tackling something that I think we can all relate to: insurance denials.
Oh, it's definitely a frustration for sure. We work so hard, we put our all into taking care of our patients, and then bam, a denial just appears. It's like someone saying, hey, we don't believe you. It's just a lot of stress for everyone.
It is, and it's so much more than just paperwork.
Yeah.
It's about making sure our patients are getting the care they need when they need it, without any delays or added financial stress. So we're going to break down some very practical steps you can take to prevent those denials.
Yeah, and we're into this awesome article, How Nurses Can Prevent Denials, Proactive Utilization Management Strategies by Dr. Nicolas Abella. It's in the Nurses Link Up Journal. It's great because it really emphasizes how much influence nurses have in this.
I love that. We are taking charge. So before we get to actually preventing them, let's just talk about why denials are so harmful. Okay, so picture this. You've spent hours getting everything together for a patient. You've charted everything. You've fought for them to have a smooth transition, maybe to a skilled nursing facility, and then denied.
Oh, I know. That is rough. Their discharge is delayed, it sets back their recovery, and now their families are scrambling to find other options. And think about the emotional toll on everyone. It erodes trust and makes people question everything.
Exactly. Plus, there's the financial side of things. Denials really mess with a hospital's revenue. It can lead to staff cuts to treatments. It has a ripple effect on everyone.
It does. And here's the thing. Most of the time, it's not because the patient didn't medically need the care. The problem is how we explain that need to the insurance companies. It's like we're speaking two different languages.
I love that analogy. We are totally fluent in patient care, but we need to learn how to speak insurance just as well.
Exactly. We need to close that communication gap, make sure our documentation is clear and concise. We need to paint a picture for the people reviewing those charts who haven't actually seen the patient.
All right, so let's get specific. What are some of the most common documentation problems that lead to denials?
Well, one of the big ones is not giving enough information. We might write something simple like patient stable, but what does that actually tell the insurance company? Nothing. They need the details, vitals, interventions, how they're responding to treatment, really describe what's happening.
So instead of wound care done, it should be the type of dressing, how much drainage, and the patient's pain level.
Yeah, those little details can make a huge difference. And then there's a lack of specificity, like instead of tolerating diet well, say what they ate, how much, if they had any problems swallowing or anything like that.
It's about painting that clear picture, right?
Right. And crucial stuff, like if they can walk, their home situation, their discharge plan, it all helps to show why they need the level of care they're getting.
Like someone who lives alone and can't walk might need more care than someone who has family helping at home.
Exactly. And then, of course, there are communication breakdowns. The nurse thinks a patient needs a medication, the doctor orders it, but the case manager doesn't know and flags it as unnecessary.
Oh, wow, that sounds like a disaster waiting to happen. We need to be on the same page, working together to advocate for our patients. That takes communication.
Absolutely. Oh, and we can't forget about the different requirements for each payer. Every insurance company has their own, quirks, and we need to be familiar with them.
It's like playing a game without even knowing the rules. You're going to mess up. We need to know what each payer wants for pre-authorizations and the specific criteria for different procedures.
Exactly. Now, for nurses feeling overwhelmed by all this, don't worry. There are lots of resources to help you navigate it all.
Speaking of resources, I want to mention all the great tools and support you can find at healthcarenurses.net. There are articles, checklists you can download, even case studies to help you out with preventing denials.
It's a fantastic website, really designed to give nurses the knowledge they need.
So we've got the basics down.
Yeah.
Now let's talk about proactive strategies that give you, the nurse, the control. We'll be right back after a quick break to explore how you can become a true advocate for your patients and your hospital.
All right, so, nurses are busy, really busy.
Oh, I know it.
We hear things like, I don't even have time to chart, never mind think about denials.
For sure, we are juggling a lot. But honestly, preventing them will save you time later.
Yeah.
Dealing with the denial means more paperwork, more phone calls, way more stress. It's like you take one step forward, then you're forced to go back too.
It really is. It's about working smarter, not just harder, Pick out what's really important, what shows why they need that care.
So what kind of stuff are we talking about?
Think about how sick they are, how intense the services they need are, how they're responding to it, anything that makes it more complicated. Those are the things that the insurance companies are looking for.
Okay, so you pick out what's most important, but it can still be really overwhelming to chart it all. Any tips on how to make that faster?
Oh, templates and those smart phrases are your best friend.
Oh, yeah.
Save you so much time, but always make sure you adjust them to fit that specific patient. Don't just copy and paste.
Right. They're tools. They shouldn't be dictating everything. Another one I hear all the time is, I don't even know what the payer wants.
Right.
It feels like you're just guessing sometimes.
Well, that's where your case manager comes in, or that utilization management department. Talk to them.
Okay.
They're the experts on all that insurance stuff. Don't be afraid to pick up the phone, ask them to explain something.
So they're like our secret weapon against denials.
Exactly. They want to prevent them just as much as you do. They know all about what each payer needs and the best ways to document things.
Great. Okay, so we've gone over some of those concerns. Now let's get to those proactive strategies. What are some things nurses can do to, really build up their denial prevention toolbox?
Okay, well, the big one is knowing how to document that medical necessity. We've talked about being specific, painting that clear picture, using those objective facts. It's about really building a strong case for why your patient needed that care.
And those standardized assessment tools were so helpful, right? Pain scales, functional assessments, all those.
Yes. Those give you the objective information that insurance companies want to see, takes the guesswork out of it. And another one, document every conversation you have. Doctors, case managers, anyone.
Oh, really? Why is that so important?
Those conversations are full of information that proves why the care was necessary.
Okay.
Maybe you talked to social work about a patient's home life, or you advocated for a certain treatment with the doctor. Write it all down. It makes that patient's story more complete.
That makes sense. Connecting all those dots, showing why you did what you did. And of course, got to know those payer-specific rules.
Oh, yeah. Definitely. Learn the rules for the big payers in your area. What do they want for pre-authorizations, specific documents for certain diagnoses or procedures? Knowing that stuff is crucial.
It's like a cheat sheet for each company almost.
Yeah.
What if you think a denial might be coming? What should you do?
Speak up. Tell someone. If you see something that's a red flag, talk to your nurse manager or utilization management. They can help you figure it out and fight for your patient.
So being proactive instead of waiting for the denial to show up.
Exactly. Catch those problems early before they become big problems. And another thing that's important, stay up to date.
Keep learning new things. Keep those skills sharp.
Yes. Healthcare is always changing, so we've got to keep learning. Go to training, read those journals, watch webinars, lots of ways to keep learning.
And, nurse leaders play a part in that too, right?
Yeah.
Making sure we have that support.
Absolutely. Managers, CNOs, they need to keep their teams updated, give them resources, regular meetings, emails, anything like that. Use it all to share that important information.
So it's about creating a learning environment, always trying to get better on every level.
Exactly. When you invest in your nurses, you invest in the whole hospital. Because knowledge, that's power, especially when you're trying to prevent denials. And, to empower nurses even more, don't forget about healthcarenurses.net.
Yes. They have so much information, articles, checklists, even case studies, all about preventing denials. It's a great website for any nurse.
So whether you've been doing this for years or you're just starting out, head over to healthcarenurses.net, boost those denial prevention skills. You'll be glad you did.
Now, before we wrap up, let's remember why all this matters. It's easy to get lost in the paperwork and, all the technical stuff.
Yeah.
But really, it's about standing up for our patients.
That's it, yeah. Preventing denials isn't about paperwork. It's about making sure our patients get the care they need, no delays, no extra costs for them.
Being there for them, making sure someone hears them.
And it's about keeping our hospitals strong financially so they can keep giving everyone great care.
So everyone wins. And nurses, we're the ones leading this charge.
We can make a real difference, and it's so exciting to see nurses all over stepping up, becoming those denial prevention experts.
We've talked about a lot today.
Yeah.
Why denials happen, how to prevent them, and now it's time to actually use all that knowledge.
Let's stop just reacting and start being proactive. Let's stop feeling overwhelmed and start feeling empowered. We can do this.
We'll be right back to finish up this into preventing those insurance denials. Okay, we're back, ready to wrap things up, talking all about those insurance denials.
Yeah, it's been great. We've covered a lot of ground. What they mean, how to stop them before they happen.
Absolutely, and I hope everyone listening is feeling a little more in control, ready to make a difference.
I hope so too, because like we said, knowledge is power, and you've got the info you need now. You can be that denial prevention champion for your patients, for your hospital.
So as we finish up, I have a little challenge for everyone. What's one small thing, just one, that you can change today to start preventing those denials?
Maybe you could try being a little more specific in your charting. Or take 5 minutes, just 5, to really look at what one of those payers wants.
Yeah, good one. Or maybe call your case manager just to double check something, or even just tell a coworker about what we've talked about today.
It all adds up. Every little bit helps. Better care for our patients and a healthier healthcare system.
And remember, you're not in this alone. Go to healthcarenurses.net. Tons of resources there, tips, support, everything you need.
It's a great community, nurses supporting each other. It's how we can really change things.
Thank you for joining us on the Healthcare Nurses Network podcast. We're all about giving you what you need to be the best nurse you can be.
Keep learning, keep speaking up for your patients, and keep making that difference.
Until next time, take care and stay empowered.